Washington. The Trump administration said Thursday that it would allow states to impose work requirements in Medicaid, a major policy shift in the health program for low-income people. Federal officials said they would support state efforts to require able-bodied adults to engage in work or other community engagement activities as a condition of eligibility for Medicaid. Our fundamental goal is to make a positive and lasting difference in the health and wellness of our beneficiaries, and today's announcement is a step in that direction, said Seema Verma, the administrator of the Federal Centers for Medicare and Medicaid Services. Ms. Verma said the Trump administration was responding to requests from Medicaid officials in 10 states that wanted to run demonstration projects testing requirements for work or other types of community engagement like training, education, job search, volunteer activities, and caregiving. The proposals, she said, came from Arizona, Arkansas, Indiana, Kansas, Kentucky, Maine, New Hampshire, North Carolina, Utah, and Wisconsin. Advocates for Medicaid beneficiaries said the new policy was likely to be challenged in court if people were denied coverage for failure to meet a state's work requirement. Federal law gives the Secretary of Health and Human Services broad authority to grant waivers for state demonstration projects that promote the goals of the Medicaid program. In the past, federal officials said that work was not one of the purposes of Medicaid. But Trump administration officials said Thursday that work requirements were consistent with the goals of Medicaid, because work and other community engagement activities could improve the health of Medicaid beneficiaries. Productive work and community engagement may improve health outcomes, Brian Neal, the director of the Federal Medicaid Office, said Thursday in a letter to state Medicaid directors. For example, higher earnings are positively correlated with longer lifespan. In addition, Mr. Neal said, researchers have found strong evidence that unemployment is generally harmful to health, while employment tends to improve general mental health. A 2013 Gallup poll found that unemployed Americans are more than twice as likely as those with full-time jobs to say they have or are being treated for depression, Mr. Neal said.